Okay, so now moving on to the breast inspection. The overall general appearance, I see a few tan lines. I don't note any hypo or hyper pigmentation. Seems like he has you wear wife beaters often in the sun? Okay, I can see the outline of your tank top. You can see he does have gynecomastia. His nipples are symmetrical, as well as his pectoralis muscles. There's no atrophy. The nipples aren't inverted or disproportionate. As we continue to assess the breast, we are noticing if there's any dimpling of the skin, if there's any asymmetry. As we move through the maneuvers to screen for retraction, we're going to assess for the changes as well. Okay, can you raise your hands to the ceiling? All right, and can you put your hands on your hips and lean forward? Press and lean forward. Okay, I'm going to assess your lymph nodes. You can sit back. I'm going to do the right hand over your head.
Oh, yeah.
Yes. As we did before.
Can leave my other hand, right?
You can just rest your other hand. We're going to assess for any lymph nodes. Okay, hand down. We're going to assess the supraclavicular for any lymph nodes, as well as the infraclavicular for any lymph nodes. Alright, can you raise your left arm so I can assess for your lymph nodes and your axilla? Okay, and there are no palpable masses in that aspect. Okay, while we're looking at the chest, we can also notice the thoracic cage. It is symmetrical. There are no apparent deviations or disformities. As we note his work of breathing, there isn't any accessory muscle use. The skin color is uniform and appropriate for the ethnicity. The hair that's distributed on the abdomen and the chest are all uniform as well, and even throughout. Our position is erect but slightly slouched, and our facial expression does not exhibit any discomfort, any pain, and our level of consciousness is still alert, appropriate, and oriented. Okay, now I'm going to take some time to palpate the interior and posterior thoracic cage for any tenderness, tactile firmitis, or any masses. Okay, can you lay back down for me? It might be a little easier for you to do. Okay, so using the palmar side of my hand, I'm going to assess for any tactile firmitis. None felt on the right. I'm going to assess the left as well. Okay, the chest is symmetrical in size. He has a wide chest, but not barrel shaped. Okay, as we assess the thoracic cage, the shape is symmetrical. The anterior posterior diameter is greater than the inferior diameter. The respirations are easy and unlabored. doesn't have any signs of tachypnea, any nasal flaring, and the chest is symmetrical in expansion. There are no evident signs of retractions. As we evaluate the accessory muscle use, there isn't any. The skin color is appropriate for ethnicity. We don't know any cyanosis or pallor or any lesions. He does have what appears to be a birthmark on the right side of the chest. His position is relaxed. The facial muscles are relaxed as well. We don't notice any pursed lip breathing, and the patient is alert, cooperative, and isn't restless. As we palpate the posterior and interior chest, we don't know any tactile firmitis using the palmar aspect of our hand. On the left side, moving to the right, there's none felt as well, nor are there any masses or lesions. Next, we're going to move on to auscultation and listening to his breath sounds. As we auscultate our breath sounds, we're going to start at the top, above the clavicle. Deep breath in and out. In and out. In and out. In and out. In. Okay. In and out. In and out. In and out. In and out. As we listen to those breath sounds over the trachea and the sternum, we can hear the bronchial breath sounds. From the right sternal border, we can note the bronchial vesicular breath sounds. And over all fields, we can indicate that there are vesicular breath sounds. I didn't hear any adventitious breath sounds. Crackles would be like a wet bubbling sound. Wheezes would be like a whistle. Our rhonchi would be like a low-pitched whine, and our friction rev would be a harsh grating sound. All right, now that we have our client in a 30-degree angle, we're going to assess for JVD, which indicates an increase in the venous pressure, indicative of heart failure. You can turn your head to the right. Okay, so we do not see an increase in the JVD. The vein is actually flat. We would find the sternocleidoid mastoid muscle and use it as a landmark as we assess the JVD. Okay. Okay, we will now assess for the carotid as we did earlier when he was in the upright position. Can you turn your head to the right? want to palpate it one at a time to not occlude the blood flow to the brain. Can you turn on the left side? All right, and both of the pulses are moderate 2+. They're not so both pulses are moderate and 2+ and equal bilaterally. Now we're gonna palpate for the apical pulse. We're gonna find the 4th and 5th intercostal space and mid-clavicular. Okay, I feel the apical pulse. I'm going to use the palmar to inspect the pericardium. All right, now we're going to, all right, we will assess the posterior of the thoracic cage, just as if we were doing the front. Okay, we're gonna start at the top. Breathe in and out, 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 in and out. Okay, and on this side, in and out,